Good morning, everyone, and welcome to this webinar titled Paunang Lunas Siguradong Ligtas. I am Dr. Diane Fabellion, one of your speakers for today. Good morning, everyone, and welcome to the webinar titled Paunang Lunas Siguradong Ligtas. So I am Dr. Diane Fabellion, one of your speakers for today. For a better viewing experience, let me guide you through this Zoom webinar. You can click View Options on top, move the cursor to Zoom Ratio, click Fit Window, check the side-by-side mode so that you have a good view of the slides and the speakers. You may type your questions in the Q&A box below. Once you click the Q&A box, you may type in your questions here. You may click the chat box before it ends. Click on the Leave button below. We are happy to announce that we will now be streaming on the FB pages of the Medical City Institute of Pediatrics. Will also be aired on FB pages and our YouTube channel. So, welcome again to our Zoom and our FB participants to our webinar titled Paunang Lunas Siguradong Ligtas. So starting this year, our webinar series will be called IPLA's Coffee and Conversations. So we hope to fill your morning with gems to power up your Saturday morning. So grab a cup of coffee and just relax. Before we start our webinar, let us view this video.
Morning, everyone. I'm Dr. Jojo Matiban, and I'm here to be part of the coffee conversation. So while we're seeing the videos, I think we can have the video again, prompt up later. So it's nice to see or be here with everyone sa Coffee and Conversations ng Institute of Pediatrics ng Medical City. So as mentioned, this is part of our series of webinars sponsored or by our Institute of Pediatrics Learning Academy under the Medical City. Morning.
Good morning. So, starting this webinar is brought to you pala by the Institute of Pediatrics Learning Academy. So, watch out for this logo for our future webinars. So, now I have my coffee and I'm ready for our conversation. So, to start our webinar, let me first introduce you to my partner for this morning, Dr. Jojo is a consultant staff of the Medical City Institute of Pediatrics. He is also the head of the emergency room unit of the Department of Pediatrics of the Gigpateros District Hospital. He is an experienced basic life support provider and instructor of the American Heart Association. Good morning, Dr. Renel Matibag or Dr. Jojo to all of us. Hi!
Hey, good morning, Diane. I have my coffee with me. So, you introduced me. Ako naman nag-introduce sa'yo. Si Diane is also a part of our consultant staff in Medical City and also a lactation consultant. She's part of the Ateneo School of Medicine faculty and also former head of the emergency room committee of the institute. And just like me, she has experience as a basic life support provider instructor for the American Heart Association. So, good morning, Diane.
Good morning, Dr. Jojo, again. So, again, welcome to our webinar, Paunang Lunas, Siguradong Ligtas. I think itong webinar na to napaka-relevant, especially ngayon na return to school. Maraming mga aksidente na pwedeng mangyari, tsaka mga situations na pwedeng mangyari sa bahay at tsaka sa eskwelahan. Di ba, Dr. Jojo?
Agree. Ang dami na. Simula na ng school, my kid is also starting school na. So medyo pag face-to-face, mas maraming pwede mangyari. So, pwedeng may mga tanong kayo sa mga common injuries, common accidents na nangyari o pwedeng mangyari. So, we're here to talk about it.
So ako naman magtatanong sa kanila. So ano sa tingin nyo yung mga common na mga injuries or mga accidents na pwedeng ma-encounter sa bahay or sa school? So you may type it in the chat box. Tapos let's see, baka naman ma-encounter or madidiscuss natin ngayon yan this morning.
Okay. So while waiting for for your questions sa chat, pwede nating discuss yung mga madalas namin nakikita or madalas namin nakukuhang tanong. So yan, may mga nagtatanong about nahuhulog o kaya nadadapa. So part of common injuries, whether it's sports or yung usual play lang sa school or sa bahay, is yung head injuries. At ang dami-dami nito, Diane, or madalas na maging tanong. Ano ang pwedeng gawin kapag na bagok, nahulog, tumama yung ulo, na aksidente yung isang pasyente, especially our kids? So sa atin, we always tell our patients to look for warning signs. Ang warning signs natin is kapag nawalan ng malay, pag hindi nagre-respond yung pasyente sa'yo, hindi sabihin talagang hindi nakakausap, hindi nakakapag-interact. Pag nag-complain ng changes in vision, like nagba-blurring yung vision, o kaya may difficulty na makapag-maintain ng vision, kapag may sugat na malaki or parang seryosong wound, serious wound, parang medyo unusually large or big sa pasyente, kaya kapag mayroong mga lumalabas na dugo or fluid, whether it's clear or bloody sa nose at sa ear, medyo may pwedeng sign siya ng severe head injury. And of course, something very definite and ma-observe is kapag nag-change in behavior, very agitated, very confused, or even complaining of being very sleepy. Those are warning signs. Pag warning signs, ibig sabihin, kailangan pakita sa doktor or dalhin sa ospital. So just to reiterate, kapag malalaki yung sugat natin sa head, more than an inch, half inch, pwedeng dalhin sa ospital. Kapag sobrang mag-bleed, ibig sabihin, even if you put pressure dun sa wound, hindi pa rin tumitigil after 5 to 10 minutes. So you have to make sure na pwede natin siyang madala sa ospital or sa doktor. Pag may mga foreign objects or yung dirt or dumi na nado sa sugat mismo, pwedeng dalhin agad sa doktor para malinis at ma-examine na rin yung sugat. And then, kung merong nga o nakabuka yung sugat, kasi we'll talk about stitches, pwede natin describe or pwede natin pag-usapan kung kailangan niya ng stitches. And of course, whether may sugat o wala, pero extremely painful, parang sobrang umiiyak, nagwawala yung pasyente, kahit wala kayong makitang sugat, pwede din sa ospital para properly assess. And then longer periods, kapag nagkaroon naman ng sugat, kahit maliit or malaki, tapos nakakita kayo ng signs of infection, ibig sabihin naging grabe ang itsura, pwede nyo rin padala sa doktor para ma-examine if there's a need for any interventions. Kapag naging mainit, malaki, namamaga, may discharge na lumalabas, those are the things that you can see. If you see those things, dalhin agad sa doktor para ma-examine, para malaman kung anong dapat gawin. Right?
Parang bago to,
For,
sir.
ricer. O, dati kasi rice. Ito naman para sa mga sa mga nahulog, nadapa. Tawag ng natin is usually pag natapilok. Pag natapilok, may mga first aids na ginagawa. A good mnemonic is ricer, dati rice. Rest, ice, compression, elevation, and the last one is referral. Referral is, syempre, referring sa doctor. So rest is kapag natapilok yung area, kahit sang area na merong pilay, dapa, tapilok, rest mo muna. So don't put pressure. So if the patient was playing, stop playing muna. Lalo na doon sa area kasi you're going to put more pressure on that area. You can put ice, usually sa up every 15 to 20 minutes. For 15 to 20 minutes, mga 2 to 4 hours, every 2 to 4 hours. Pero usually I advise na ang gagawin is pwede nating bigyan siya ng pain reliever ng ice para mabawasan yung pain yun. Tapos you can do it up to 72 hours post-injury. Yung compression naman, pwede lang itong i-immobilize. Pero usually, you have to make sure na hindi siya mababawasan na mawawalan ng blood flow, perfusion. Kasi minsan kapag natapilok, sobrang higpit, halos nagpa-purple na yung area na yun. So, hindi kailangan sobrang tight. You're not going to prevent swelling. You're just going to immobilize. Hindi dahil gusto mong ipitin para pigilan yung pamamaga. Mawawalan ng blood flow yung distal part. So, hindi dapat sobrang tight. Kasama din sa compression will be the elevation part, kaya siya makadikit. After lagyan ng compression or lagyan ng bandage to immobilize, kailangan i-elevate para ma-improve rin, mabawasan yung swelling. Yun na actually mas makakapagpabawas ng swelling. At saka part of immobilization na rin yun. And then, kapag kailangan i-refer if we're considering mga signs of fractures, di-discuss rin natin later, pwede nating i-refer sa doctor. Tapos, wag muna dun sa our friendly neighborhood hilot kasi di-discuss natin rin mamaya yan. Dun sa last part, yung X, yung mga bawal or hindi suggested, di-discuss din natin mamaya. Okay?
Okay.
So, eto yung sa fall, pag nahulog, sa mga tapilok site, sa mga paa. Pero special attention kapag ang tumama is yung neck, back, or spine.
Medyo
Kasi we're worried
delikado
about
to, no?
Oo, nerve injuries kasi yan ang binabantayan natin dito. So kahit wala kang makitang sugat, pero kapag nagkaroon ng severe neck or back pain, pwede natin pakita sa doktor or dalhin sa doktor. Anytime that you have inability to move a certain part of the body, kahit anong parts yung tumama ng neck, back, or spine, tapos nagkaroon ng difficulty moving one part of the body, pwedeng dalhin sa doktor. Kasama ng weakness, tingling, or numbness, yung parang namamanhid, dalhin agad natin. And since we're considering nerve damage or nerve injury, kapag may changes sa bowel or bladder control, particularly kapag sa lower back, lower spine area, nag-complain or na-observe nyo na may changes sa bowel or bladder control, pwede natin pakita agad sa doktor or sa emergency room. Okay. Yung dinidiscuss natin kanina, medyo mas grabe, no? Yung head injuries na grabe, yung neck injury, back injury na grabe. Yan. Pero pwede rin magkaroon ng mga simple cuts and bruises o yung mga galos, gasgas. So, galos at gasgas, I think natin. At some point, nakahandle na tayo nito at meron tayong mga basic or parang first aid na alam natin. Main thing is cleaning lang. It doesn't have to be any strong disinfectant kaagad. Mild soap and water, pwede na pong gamitin. Pwede siyang panglinis sa sugat. You can actually cover it. Yung magtatanong is kung pwede ba lagyan ng Band-Aid. Yes, pwede po. Ang importante is i-observe, check niyo yung wound daily. Kapag nabasa, nagkaroon ng dumi, kailangan palitan. So kapag napalitan siya, i-observe niyo ulit kung kailangan siyang i-change. Tapos kapag nag-form na ng langib, yung scab, pwede na pong hindi lagyan. Kasi pag may scab na siya, it's starting to heal, cover the wound. So pag naglagay ka ng Band-Aid or any bandage, minsan sasama na. So tatagal yung healing, yung forming ng cover kasi tatanggal ulit yung langib. So, pwede na pong hindi lagyan ng bandage kapag may langib na. Pero, lilinisin pa rin and i-check yung wound daily.
And you just
Those are from
can with water and mild soap lang, no, Doc?
Yes, pwede po. Yeah, you just have to maintain it clean. Yun yung mga simple na cuts and bruises or gas-gas. No? So yung sa left side is yung mga dapat gawin, usually for mga mild cuts and scrapes na natin. So number 1 talaga doon sa picture, you can see it. Cleaning lang talaga siya. Tapos apply pressure. Yung tourniquet to stop bleeding, hindi po pwedeng gawin o hindi dapat kailangan gawin. That's going to cause more harm than good. Kasi hindi kailangan. Stop yung blood flow para doon. The pressure doon sa lower area will stop the pressure, makaklat siya. Severe cases naman on the right side, sana hindi mangyari. Pero pag nangyari, ito yung kailangan natin dalhin sa doktor. Pero yung mga first aids na kailangan natin gawin is number 1, parang put pressure dun sa bleeding area. Anytime na merong injuries caused by bites, burns, punctures, yung mga parang natusok, even electrical burns, kailangan dalhin sa doktor to assess. Pag severe yung cuts, malalaki, kailangan ipakita. In severe cases na huwag naman sana magkaroon ng amputation or any part of the body was natanggal. Immediate first aid. I had siguro in my whole training 2 times nakakita ko na ganito na natanggal yung part. Stop the bleeding, control the bleeding by putting pressure. Tapos yung part na natanggal, secure it in a clean plastic or clean cover and then put it in ice. So nakita niyo sa picture yung ginawa niyan. Tapos dalhin sa emergency room sabay ng doktor.
So important, Doc, ilagay muna sa separate na plastic, i-seal before ilagay sa ice.
Para ma-less rin yung contamination. Pero syempre kailangan dalhin. So yun, kapag mga ganito, this is not your mild gas-gas or galos. So, kailangan dalhin sa ospital and sa doctor. So again, our friendly neighborhood children's emergency or hospital emergency room is available. If you can't stop the bleeding, if there's very prominent dirt o kaya parang foreign body, foreign object, kailangan dalhin sa ospital. Pag mayroong injuries sa face or neck na medyo worried na mas malaki, like I mentioned kanina, the size and the bleeding, pwede dalhin. Pag animal or human bite, pag electrical burn or regular burn, basta may burn or puncture wound, yung mga napapako, pwede pong dalhin sa ospital. Yung the size is pwedeng ma-assess mo yung size, pero pag kahit maliit pero persistent o malakas yung pag-bleed, kailangan rin dalhin sa doktor. So yun lang, kailangan natin go-observe for us to determine if we need to do first aid. We do the first aid, pero after doing the first aid, if we need to put or bring the patient to the doctor or to the emergency room. Okay. So meron tayong head injuries, falls, na tapilok, simple, gas-gas, mas hindi simple na gas-gas or yung malalaking sugat. Ito yung isa sa favorite natin, Diane.
Bali daw, Doc.
May bali yung pasyente. May bali. Sa Philippines kasi ang hirap kasi sometimes i-differentiate yung mga ginagamit nating terms. Pag medically, sinabi nating fracture, we're talking about a damage in anatomy of the bone. Sa atin dito, pag sinabi nating bali, pilay, ngalay, sometimes nag-overlap yung mga mga descriptions. So pag sinabi nating fractures, it's usually bali or bali. Okay. So how do you determine if it's a possible fracture? Pag nakakita ka ng deformity or something different. So usually, kapag an area is one side of the body, so you have a comparison sa other side. So for example, right and left, if na-injure yung left, you compare it to the right. So if you see some deformity, swelling, or bruising as compared with the normal side, pwedeng you're considering a fracture or damage to the anatomy. Pag merong sobrang pain or difficulty, yung pain, combine siya dun sa deformity, swelling, bruising, most likely that's a fracture. Tapos kapag may difficulty moving, pwede kasing hindi siya fractured, pwedeng na-strain lang siya. Pero again, if you see some deformity, swelling, and bruising around the area, coupled with pain and limb difficulty ng movement, most likely there's a fracture. Or kapag nag-change yung anatomy, it looks shorter, twisted, or bent, medyo may clue ka na may fracture talaga siya. And of course, pag may nakita ka talagang bone na lumalabas, so that's called an open fracture. Malamang sa malamang, may bali.
May bali talaga siya.
Tapos,
ibalik, Doc.
okay. Yun yung questions na madalas natin gawin. Okay. Unang-una kapag nagko-consider ka ng fracture, do not try to move the person kaagad. Nabanggit natin yung may mga instances na nabalian na rin ako eh. Naalala ko may sumisigaw na nabalian ako. Hilahin niyo. Medyo sumigaw ako, wag niyo hilahin, wag niyo hilahin. Kasi lalong makakasama kapag you try to move it, lalo na if it's not a dislocation. When you're going to relocate or address a dislocated bone, you do it kapag trained ka. But if it's not actually dislocated and it's a fracture, or you're not trained to do a dislocation o parang balik yung dislocated shoulder, mas maraming harm ang mangyayari sa pasyente. So don't try to move the person unless may injury, possible injury dun sa site. If there's any bleeding, so like for example nga may fracture, may open wound pa rin siya, you can also do the same step kanina, stop the bleeding. And kapag kailangan immobilize pa rin yung pasyente sa injury area. Para rin siyang riser. Kanina, rest, ice, tapos compress, and then yung elevate. Ice packs, pwede rin siya. So kailangan siya makabawasan ng pain. Yung treatment for shock, kasi sometimes severe pain na apektuhan yung vital signs ng pasyente. Blood pressure may be compromised. They can have some signs of confusion. Sometimes parang hindi maganda yung breathing patterns nila kasi nag-exacerbate yung breathing nila because of the pain or the shock. Pag ganun, stabilize the patient by making the patient comfortable. Pwedeng elevate yung paa, increase or improve your blood flow. Tapos make sure well ventilated para makatulong sa ma-stabilize yung patient. Okay? Okay. So, Dayan, na-discuss ko yung mga hindi ko naman masabi parang mga active injuries or common injuries, yung mga activity, yung mga talagang may involved sa sports at saka yung mga takbo, hulog. I think there's mga questions dito kanina. We'll go through it later, no? Particularly yung sa may concern about changes sa color ng labi after umiiyak. Sige, tingnan natin yan, ma'am. I-discuss natin sa open forum natin. But Diane, I think you can discuss some of the other common injuries na nakikita natin sa mga patients natin.
Okay, so one of the most common injuries na nai-encounter kinoconsult minsan sa clinic is insect bites and stings. So lahat tayo nakaranas na nito at one point to another. So pwede din siyang mild, pwede siyang maging malala. So usually ang symptoms nito kapag may bites and stings is yung masakit doon sa injection site, minsan namumula at saka namamaga tulad ng nandyan sa picture. Pero ano ba yung mga pwede nating gawin kapag meron tayong ganyan? So first, you can put cold compress dun sa area para ma-minimize natin yung swelling. Kung pwede, i-elevate or itaas yung affected area if possible. If masakit talaga, pwedeng magbigay ng pain medicine like paracetamol, or sometimes nagbibigay tayo ng anti-allergy medicine, or sometimes even a hydrocortisone cream para hindi masyadong mamula at saka mangati yung area, no? This is for mild reaction. Pero sometimes naman kung minalas, ang kumagat is a bee, naiiwan minsan yung sting nila dun sa skin. So we need to remove it by using our nail to flick it off. Or pwede ka din gumamit ng credit card tulad ng nasa picture para i-flick off yung skin. So wag na wag yung pipisilin.
Kahit debit card, pwede naman daw. Debit card, hindi naman
Debit card pwede.
Pwede.
So remember, wag pisilin pababa kasi baka we might introduce more toxin dun sa skin if we do it. So flick mo lang away. Okay. So what if medyo severe yung reaction, like yung bata nagkaroon ng parang naduduwal siya, nausea, sumakit yung tiyan, nag-diarrhea. As you can see, yung swelling dun sa infected area more than 2 inches, talagang malalaki talaga siya. Minsan medyo nahirapan silang huminga. Tapos as you can see sa picture, namamaga yung mouth, yung face, yung lips, yung tongue and throat. Minsan yung ears din namamaga. Pag ganito, severe allergic reaction na to. So dalhin na siya sa doktor immediately. So as I said earlier, most insect bites and stings are usually harmless and can be managed at home. Pero kapag may mga danger signs na, dalhin sa emergency room kasi baka mamaya nagkakaroon na ng severe allergic reaction or anaphylaxis ang patient. Okay. So other common medical conditions na medyo common ngayon, especially during and after the pandemic, is yung panic attack. So yung panic attack kasi is parang mabilis siya and an unexpected episode ng severe anxiety. So yung marami mga obvious triggers pero yung iba basta nangyayari na lang kasi. So medyo nakakapanik din at saka sakit sa puso on the part of the parents na makita na nagkakaroon ng panic attack yung anak nila. So ano ba yung mga signs and symptoms na yung anak natin pwedeng nagpa-panic attack? So pwede silang nagsho-show ng hirap mag-concentrate, laging parang worried or anxious, more clingier or more attached than usual. Tapos parang ayaw na ayaw nila certain situations or certain locations. And when you expose them to that, they become more irritable, frustrated, tsaka fidgety. Tapos sometimes also hindi mo ma-explain pero nag-complain sila ng complain ng masakit ang tiyan or parang may masamang pakiramdam pero hindi naman natin ma-point out kung saan yun nangyayari. And sometimes they can also experience hirap na magtulog or lagi silang pagod. So, maraming pwedeng maging cause ng panic attack. So, pwede siyang namamana, pwede namang may mga phobia yung mga bata. Sometimes this is more common also in children with existing mental health condition. Sometimes may mga short-term emotional triggers like pwedeng stress sa school, sa friends, or sa bahay. Children with low self-esteem also have more often na nagkakaroon ng panic attack and use of certain substances, no? As I said kanina, ito yung mga pwedeng symptoms ng panic attack: feeling faint, dizzy or lightheaded, nauseous, masakit ang tiyan, masakit minsan ng chest, or parang hirap huminga, parang feeling mo nagpapalpitate ka, up and down yung or fluctuating body temperature, and mabilis at saka disorganized na breathing or tawag namin doon is hyperventilating. So as a parent, ano yung mga pwede nating gawin for our child? So iisa-isahin natin siya. So first is stay controlled during the attack. So during the attack, stay calm and talk to them in a gentle, soothing voice. So tell them to take deep breaths and reassure them. So once medyo nagsasubside na siya, give them plenty of space and time to calm down. So important na hindi natin sila parang kuyugin. Ano ba nangyari? Ganyan, ganyan, ganyan. Hindi ganon. We have to teach them some breathing exercises. So we can tell our child to breathe in through their nose for 3 seconds, hold their breath for 2 seconds before exhaling completely and fully. So basically just breathing in and out slowly. Okay. And then once medyo na-control na natin, turuan natin sila about panic attacks. Kasi panic attacks are common, but it's usually brief. And usually, wala namang ibang nakaka-notice nun, ikaw lang. So, hindi mo kailangang mag-worry about other people na parang pagtatawanan ka or i-judge ka kasi ikaw lang naman ang nakakaalam na nangyayari yon sa'yo. And let's encourage them to face their fears. And also to challenge negative thinking. Kasi minsan may mga naiisip tayo na mga negative na thoughts pero hindi naman kasi yun yung reality. So when we have negative thoughts, isipin natin yung realidad. So yun ba talaga yung nangyayari? So baka hindi naman. And also help our child to shift their focus. So instead of thinking yung mga panic attacks or yung mga bagay na nakakapagpa-stress or anxious sa kanila, baka pwede nating i-shift yung focus nila, maybe encourage them, bring them out on trips, new hobbies, ganyan, and reassure our child that there are always people around that care and help them. And if hindi siya nagre-resolve, palagi-lagi nangyayari, lagi naming sinasabi, always seek help. No?
Gandang ano yun. For panic attacks, ang response is do not panic also.
Yes.
So,
So,
may mga steps. So, magandang may mga pwedeng gawing first steps. Tapos yun, always open the possibility of seeking help pag medyo we are concerned that we are not able to handle it properly. Ito, yung fainting, parang pag nagka-panic attack, pwedeng mapunta sa fainting. So, you will also see patients, madalas sa mga adolescent group or older children na nakikita natin itong fainting. Pero dito pwede rin mangyari sa, sa mga mas bata. Ano bang ano natin? Anong usual first aids natin dito pag fainting there?
pag fainting, di ba, parang, naku, nahimatay, ganyan. So, pwede kasi siyang dahil sa heart condition, yung fluctuation in BP or sometimes head injury, seizure, ear problem, dehydration, low sugar, breath holding episode, anemia, or sometimes a brain problem. Alam mo ba, Doc Jojo, ang dami pala talaga, sabi mo nga, 1 in 4 healthy children and adolescents have experienced fainting at some point. So, it's fairly common. So, yung mga signs and symptoms, yung dizziness, lightheadedness, yung para kang lumulutang, namumutla, lalabo ang mata, tapos bumibilis or irregular yung pagtibok ng puso, pinagpapawisan ng malamig, tsaka parang nauseous or nasusuka. So, ang mga first aid natin dito, Doc, is first, kung parang pansin mo parang magfe-faint na siya, loosen yung tight clothing. Tapos make sure area is well ventilated kasi 'di ba common to na maraming nahihimatay sa mga kulob na area or in crowded places. Tapos check also if your child is okay. So, wag niyo siyang hahayaan na tumayong mag-isa or maglakad mag-isa if hindi pa nila kaya. If parang malapit na siyang mag-faint, have them lie or sit down with their head in between their knees. Or kapag ka nahimatay na talaga, have them lie flat with their feet slightly raised. And if you can move your child, wag no, wag mo muna silang galawin. So kasi baka mamaya yung time na nalaglag sila, mamaya nagkaroon pala ng injury. So wag gagalawin kung hindi naman as much as possible. Emergency medical care for fainting, if nalaglag, tapos baka mamaya nabaldog yung ulo, if nahihirapang huminga yung pasyente, if hindi makapagsalita ng ayos, makamove or makakita ng maayos, if nagko-complain sila ng chest pain or irregular heartbeat, kapag nagkumbulsyon, or halimbawa very active nung time na kumbaga nawala ng malay, tapos bigla-bigla na lang nalaglag, no? So pag ganon, dalhin natin yung ating patient or anak sa emergency room. Okay. So now we're done with panic attacks and fainting. Let's go yung mga other areas of concern, no? Ito common sa bahay, tsaka lagi namin na-encounter sa emergency room, di ba, Doc? So ito yung tinatawag nating poisoning. So alam niyo ba na poisoning is the third leading cause of unintentional death in children 1 to 19 years old. So
Common
ano
pala siya, no? Pwede siya mangyari. Okay.
So 'di ba sa ER no nagjo-duty tayo parang laging meron ito.
Oh,
So, ano yung mga first aid natin for for poisoning? So, depende kasi kung anong nangyari dun sa poison. So, first na-swallow ba ng patient yung poison? So, kapag na-ingest niya, get the poison away from the child. So, if yung substance nandun pa sa bibig nung anak ninyo, tanggalin ninyo yung substance na yon, remove it with your fingers. Pero wag naman to the point na parang pasusukahin nyo na yung, kung hindi nyo na makita, wag nyo nang pasukahin yung bata. Dalhin nyo na kaagad siya sa emergency room or poison control center. Paano naman kung nasa skin? So kung nasa skin, so remove yung contaminated na clothes and then hugasan yung area with lukewarm water. Huwag maglalagay ng kahit na anong ointment, butter or grease dun sa area kasi lalo pa yung makasama. And again, bring the patient sa ER or poison control. Kung yun namang poison napunta naman sa mata ng pasyente, you can flush yung eye or clean the eye by holding the eyelid in open and pouring a small steady stream of water dun sa inner area near the nose. So, huwag gumamit ng mga eye drops or eye ointment unless sinabi po ng poison control. Paano naman kung na-inhale yung poison? So, as much as possible, umalis dun sa area and get the child into a fresh air right away. Tapos bring to the emergency room or poison control. No? So, very important itong number na to. Please take note. Ito po yung number ng ating National Poison Center sa PGH. So, whether you have mild or severe poisoning, please bring your patient or your child immediately to the nearest hospital. Kasi poisoning can be deadly and immediate medical attention is warranted. So if you want more tips on how to poison-proof your house, so you can visit Safe Kids Worldwide. So meron silang extensive advice on how to poison-proof our home. Paano naman, Doc, kung na-ingest yung mga
Foreign body ingestion. Okay, so na-cut yung slide. So it's called foreign body ingestions. Yung related kanina sa poison, something na hindi dapat pumasok or na-ingest ng pasyente. When we talk about foreign body ingestion, pwedeng pumasok papunta sa tiyan or pwedeng mag-obstruct. So you see pictures na merong hirap ng paghinga. So pwede siyang may symptoms pero at the same time, pwede rin siyang asymptomatic. So be very careful assessing the patients, lalo na yung sa mga little kids. Pag medyo may kulang na mga laruan, tapos may signs ng pain, drooling, fuzziness, chest pain, or even fever in the long run, pwedeng mag-consider ka ng obstruction. So yung kapag ganito, ang tinitingnan natin is our first aid. So if na-observe nyo na meron, mga common objects kasi na nakikita natin sa mga bata na nagiging cause of obstructions, are yung mga common objects na sa bahay. So like coins, toys, jewelries, magnets, even batteries. Yung mga dati, yung mga battery sa relo, pwede yan. Nung bata tayo, Game & Watch, o kaya yung sa mga Game Boys, pwede yan. Keys, maliliit na susi, pwede. I had one instance when susi, tapos nakadikit siya sa meron pa siyang lock na maliit. Kasi di ba, minsan, so,
Pati
kita dito sa
laptop
X-ray.
na-ingest?
Oo, meron. Kita sa X-ray. Wala pa naman akong nakatulad nitong sa picture na may teleponong malaki na naipon o nakita. So, walang ganyan sa akin. Pero, point is, kapag merong signs of obstruction or difficulty breathing, pwedeng mga objects na itong usually nakikita natin. So, pwedeng dalhin sa emergency room, of course, pero ang first aid natin, if there are signs of choking, meron tayong for toddlers and children above 1 year old, version ng Heimlich maneuver. So, as you see in the picture, parang you crouch down, punta sa baba, or bababa ka sa level ng child, and then yung fist natin over just above the navel ng pasyente o sa pusod, and then you push up. So, parang matanggal siya. Pag a little older or smaller yung pasyente, yung next approach na pwede nating maneuver will be the back slap. Yung back slap natin is back sa back talaga. So sa mga parents, when we're trying to relieve the obstruction, hindi po batok. Hindi dito. Huwag dito. Kahit anong gawin niyo pong pagbatok, hindi matatanggal kung nandito o nandito yung obstruction or yung object. So you do back slap. You see the picture, yung location niya between the shoulder blades ng pasyente, and then position is pa ganun. So push up ang back slap niya. How hard? Depending on the size of the child, tapos yung strength mo, relative kung gaano kalakas nyo, pero yung pressure naman, make sure hindi naman matamaan yung ibang parts ng pasyente and hindi mag-cause ng more injuries. And you will see improvement kapag effective yung pag-backslap mo sa pasyente. So when do you know, or how can you know kung dapat ba akong mag-maneuver or not? So yung mga observe natin is if may signs of choking, tapos nagka-cough pero nakakapagsalita pa yung pasyente, it means na hindi pa completely block yung airway. So pag ganun, you can try to reach or grab the object if you can see the object. Don't do a blind sweep. Huwag mong tatanggalin kapag hindi mo nakita. You try to look for it using your hands. Lalo na kung hindi mo visualize, you'll end up pushing the object deeper and causing more obstruction. Pag nakakahinga, nakakapagsalita, pwedeng matanggal niya on his own or on his own yung obstruction. So just stay with the child and try to calm the child. Pero kapag gising pero hindi makapagsalita, hindi makahinga, nag-make ng grunting noise, and may signs of oxygenation concerns, third blue, then you can do the maneuvers. In transit, pwede nyo dalhin papunta sa ospital. You can do that maneuvers. And then pwedeng ma-dislodge na yung object na yun. Tapos you go to a position na mapagpahinga yung pasyente or stabilize yung pasyente. Ano to, medyo nakakatakot, pero nangyayari siya, and then the adrenaline kicks in sometimes. I see that I hear patients or yung parents na they didn't know that they can do it. Pero yun lang, tandaan niyo lang yung mga first aids na sinabi natin na do's and don'ts. So kapag choking, signs of choking, back slap or Heimlich maneuver, huwag yung batok, wag blind sweep, try to it. Tapos related do sa sinabi kanina ni Dayan, don't try to make the patient vomit. So that's going to do more harm than good. Okay?
So let's
Okay.
proceed na. So let's go to the myths and facts about common pediatric emergencies. Tapos answer na rin natin yung mga questions nila. So if you have questions, you can type it in the Q&A box or pwede din pong i-type din sa chat, and then we'll try to address them as we go along. So
yeah, pwede tayong open forum natin. So pwede nating open yung mga discussions natin. Answering one of the questions kanina, I think related sa combination. Yung kapag umiiyak, tas nag-violet yung labi, we see this, I'm thinking it's breath holding spells.
yes.
So yung breath holding spells can be still common, like what Diane was mentioning about fainting, common siya, pero normal pa rin yung pasyente. So what we want to watch out for is if there's a trigger. So kung ang trigger is crying for whatever reason, usually you see patients na umiiyak tapos nagbe-breath hold. Halos mawala. Nagpapanik yung parents kasi nawawala yung sound ng iyak. Tapos nagsa-turn blue yung pasyente. So those are breath holding. Pag breath holding, sometimes nawawalan pa talaga ng malay. But it can still be within normal. Ibig sabihin, walang problem sa bata. And then a certain period, peak nito is 2 years old, can happen until 6 years old. But everything developmentally normal, physically normal, then most likely nawawala na siya. For those cases, ang advice natin is look for the triggers. So if the trigger will be crying, yung mga usual na pwede mag-trigger ng crying, try to see kung saan pwedeng mabawasan yung episodes ng crying. But so again, yung more harm than good. Wag niyo pong i-shake. Yung shaken baby syndrome, kapag umiiyak yung bata tapos nakita na umiiyak, nawawala yung tunog kapag umiiyak.
Kukunin, tas gaganan eh.
Oo, yun. Okay, meron pa. Since we're discussing mga myths or yung mga nakagawian, kapag umiiyak, tapos nagbe-breath hold, so lalo nilang i-shake kasi para daw kumalma. So that's going to can cause brain injuries, yung shaken baby syndrome. Tapos meron pa sila yung hipan nyo.
Narinig ko
Tatawa ka.
na din
Narinig ko na yun eh. Kasi natatawa ka. Pero para sa mga sa mga listeners natin, hindi ko kailangan hipan yung pasyente. Well oxygenated, well ventilated, that's okay. So look for an area na may pakalmado yung pasyente. Tapos look for the cause kung ba't umiiyak. Minsan kapag younger or mga infants, basa, gutom, nagpupu, naiinitan, those causes stress sa pasyente. So pwede nating tulungan na matanggal yon para kumalma. Pero never shake a baby. For bigger age group naman po na nagbe-breath hold, you can still observe, calm them down, try to see kung bakit umiyak siya in the first place. But if nagiging recurrent, merong ibang symptoms na kasama, then you can bring the patient for a checkup. Usually check the heart, we check the lungs, even neuro exam if there's something else we should be worried about. So hopefully nasagot natin yung tanong about umiiyak and halos nagva-violate yung labi.
Usually self-limiting or kusa siyang nawawala, di ba, Doc? So usually we just carry the baby, maybe rub their back, tapos para ma-calm down siya.
Okay. There's a question about some accidental ingestion ng food na or medicine turns out to be allergic. What's the best immediate remedy? I think this is related sa combination ng poisoning at saka allergic reaction.
Allergic reaction.
Dayan, ano bang mga pwede natin gawin dito pag ganito?
Siguro pag ganon is to bring the patient na lang sa emergency room kasi para ma-assess natin kung yung degree nung parang allergic reaction kasi pwedeng mild, pwede din kasing severe. So kasi pwedeng nakikita lang natin yung rash pero baka hindi natin alam kung nagnanarrow na ba yung airway or whatever. So para sure, dalhin na lang siguro sa emergency room lalo na kung unang-unang beses na nangyari. And kung alam niyo na kung ano yung offending agent, wag na natin munang ibigay ulit yun sa bata. Kasi pwede ulit siyang mag-trigger ng another allergic reaction, maybe more severe than the first one.
Yes, yung in cases kasi na accidental ingestion, ang hindi naman parang silver lining rin is now you know na kung saan allergic yung pasyente. So the degree of allergic reaction is can be managed according to the degree nga. So pwedeng stabilize lang the patient pero pag may severe signs na kailangan ng anaphylactic medicines, kailangan na rin sa ospital. I think ang isang question rito is about antidotes kapag mayroong possible poison or reaction na hindi maganda. Can we do counter kapag allergic reactions, you have an antihistamine depending on the weight of the patient, pwede yung ibigay. So you can give actually an antihistamine if it's an allergic reaction. But for severe cases na may difficulty of airway, breathing, di makahinga, giving something orally, wag mo niyang itry bigyan ng gamot kasi lalo na yung pag mga tablet forms, yung obstructed airway because of the anaphylaxis, pag nag-try ka pang magbigay ng something, pwedeng lalo magkaroon ng obstruction. So hindi advisable. So going through some parts nun, baka matanong, Dayan, yung mga yung mga pag naka-ingest ng something, we agreed, wag nating pasukahin. So first reaction, kapag nakakain ng something possible poisonous, minsan nagpapagag sila. Ang concept is matanggal.
Oo,
So, hindi dapat. Kasi ang ina-imagine nyo, something na masama sa katawan, pumasok na sa katawan, ilalabas. So that going back can cause damage lalo na sa area. So minsan yung mga accidental ingestion of corrosive substances, pinipilit pasukahin. So something na nag-corrode na, pinasuka mo, ko-corrode ulit. So double damage yun. So wag.
Dok,
Ano yung
paano
mga
daw itlog, 'di ba? Dok, pagdating sa emergency room, Dok, nakalunok siya ng ito, pero binigyan na namin siya ng itlog at saka ng asukal. 'Di ba? Sinasabi yun usually.
Yung yung mga daw pang antidote nga.
Pangontra,
So
oo.
pangontra, parang siya. Asukal,
Puti ng
ano pa?
itlog.
Itlog, puting itlog, milk, yan.
Tubig, oo,
So
milk.
hindi rin siya outright as an antidote and that can also cause gastric irritation. So pag kunwari ingested something na medyo masama sa katawan, nagre-react na yung katawan and then you gave something else thinking that's going to be an antidote, pero lalo may irritate yung tiyan, then magpo-cause ng pagsusuka. Then again, the concern na naging lalong problematic. So, huwag niyo nang bigyan ng not known
Ng pangontra.
antidote. Oo. Yung sa watusi at itlog, yun, ginagawa yun. Pero everything else, hindi kailangan yun. Tapos, mas maganda pa rin dalhin sa ospital bago magbigay ng anything.
Yung iba daw kasi
Okay.
kung hindi papasukahin, paiinumin painumin para daw i-pass out yung poison.
Ano rin, magkakaroon ka ng gastric fullness, pwede kang magsuka, and then yung pain, pwedeng lalo mag-increase. Yun. Yung naman, Dayan, mga first aid para sa mga kagat. So, nung bata ka ba, may mga nilalagay sa mo, mga ointment na nilalagay sa iyo, mga
Yes.
pangontra rin. So, sa amin yung nakagat ng higad, nilalagyan ng suka, yung
Oo.
buong katawan.
Wala naman
Totoo ba yun? Wala
kaming
yun?
ganun, Dok. Suka, toothpaste lang.
Toothpaste, yan.
Oo.
So, hindi naman kailangan
Hindi
ng ganun
kailangan.
din.
Oo. So just wash it with soap and water, tapos you can put maybe parang antibiotic cream or hydrocortisone kung kinakailangan. Pero cold compress lang pwede na. So falls,
Oo.
ito'y pinaka-common to kasi 'di ba madalas yung mga bata lalo na yung mga baby nalalaglag sila sa crib, sa bed, sa kung saan-saan. Ang lagi po "Dok, hindi namin siya pinatulog." Hmm,
Oo, para sa mga nahuhulog, tumama yung ulo, hindi po bawal patulugin yung pasyente. Ang kailangan yung observe is, if it's the usual time or sleeping
hmm,
time na pasyente, let the patient sleep, let the patient
mm,
rest. Kasi ang binabantayan niyo is hindi actually yung pagtulog, it's the activity of the patient. If it's the
mm,
time na dapat matulog yung pasyente, hayaan niyo matulog, pero dapat hindi siya difficult gisingin. So hindi rin po totoo 'pag natulog hindi na magigising.
mm,
If there's any neurological problems, hindi yung pagtulog ang magko-cause ng neurological problems. Ang worry natin magkakaroon siya ng irritability, which is one of the signs of a problem sa head injury. Pero
yes.
hindi dahil meron talagang problem because hindi siya pinatutulog ng usual tulog niya. So I hear patients na overnight hindi pinatulog kasi natatakot na
Baka
na
hindi
hindi
magising.
na daw magising. Pagdating ng umaga, tulog.
Hmm,
Tapos dadalhin sa ospital kasi hindi daw dapat siya tulog ng umaga. Kasi hindi ho natulog ng gabi. So,
hmm,
yun. So, hindi po siya kailangan.
oo. Basta yung
About
usual
falls.
tulog, okey. Okey.
Oo. So, sa chat, meron question about, thank you po sa natin, sa mga nag-chat, regarding preparation para sa sports.
Ah,
Preventing muscle cramps while playing. So, yung hydration is
oh,
number one at saka rest. So, para dun sa nag-question po, um, yung 'pag ano po, 'pag, frequent siya, it's usually concerned about hydration and rest. Kapag medyo sobra, talaga puwedeng mag-cause ng cramps.
mm,
Yoong changes to sa body niya, if it's, acidosis yung chemical, changes sa body niya, it's usually, proper hydration lang siya. But in terms of muscle pains na medyo severe, hindi siya equal to the activity, then we have to see if we need to do some other tests. Sometimes
mm,
concerns about potassium, some concerns about even your oxygenation levels kung medyo mababa yung hemoglobin mo, you can look at it. But usually preparation wise, rest and hydration lang.
mm. Okey.
Okay.
So, ayan related pa rin dun sa pagkabagok daw, Dok. So, sometimes 'di ba pagka nauntog, so ang gagawin
Mhm.
nila tatapikin nila yung ulo o kaya yung baba kasi para mapantay daw.
Mm. Hindi daw totoo yun. Ah, hindi totoo yun na kapag ano, 'pag nabagok kailangan i-reverse. So wag niyo na pong 'pag nabagok dito hindi kailangan gantuhin. Hindi
Pero
po
ginawa
nabubugok.
sa'kin yun nung bata
Oo
ako.
nga, Ako rin, ilang beses na ginawa yun, Hindi
So,
nangyari.
hindi
Hindi
pala
naman ano, sana naman di nagkaroon ng effect. So yun.
mukhang hindi
Yung sa
naman,
fractures naman Yung sa fractures naman, Dayan, yung nabanggit natin kanina, wag niyong hihilahin talaga. Wag niyo try
Mm,
ihila o i-correct na sarili. So, maintain niyo lang sa sariling posisyon. Pero, nabanggit ko kanina to about hilot. Kailangan bandalhin
oo,
sa
kailan
hilot.
iba kasi Dok, 'di ba, culturally kasi 'pag sinabi nating hilot or bale from yung manghihilot, it's totally different from what we say as bale medically. So 'di ba na-discuss mo kanina 'pag sinabi nating bale medically, talagang mayroong bone na na-break. So this is different from yung bale from the hilot, which is iba yung ibig nilang parang sabihin talaga. So pagka may nabali, wag niyo nang pahihilot tsaka paggagalaw tulad nung sabi ni Doc Jojo earlier during the discussion. Lalo kasing
Yeah.
makakasama if minanipulate pa natin.
Yeah, yun, tama yan. So, stabilize lang muna. Pwede yung i-ice, pwede yung compress, pero wag yung try, ayusin on your own. Yung masahe, iba yung masahe versus trying to correct the fracture. Yung iba kasi, so medyo alarming. I see videos sa social media na dinadala sa isang lugar na tinatry i-correct ng untrained personnel. So please po, Even if it's a mild tapilok o yung parang sprain, and lalo na kapag severe na you see the signs of fracture, huwag niyo pong dadalhin sa hindi trained professional and try to correct it on their own. More harm than good. So, yan. And just going back lang kanina, I think nasagot sana natin yung tanong about allergic reaction in sugar. Sugar does not correct allergic reaction po. If there's an allergy concern, it's usually an antihistamine or medicines depending on severity. May gamot po tayo for anaphylactic or severe allergic reaction. So sugar is not usually given, should not be given for allergic reaction.
Hindi po siya antidote sa allergy. So, tungkol naman sa abrasions, Doc. So, di ba ito, pagka nagagasgas tayo, so may mga nilalagay sa atin ng mga bata, tulad nung na-mention before, nilalagyan ng mga dahon, binubudburan ng gamot. So, kailangan pa ba yun?
Natatawa ako kasi naalala ko this very, very distinctly kung anong ginawa sa akin. So, hindi ko alam po kung meron pa. Siguro mga 5 years ago, I see some patients doing this. Yung antibiotic capsule, particularly amoxicillin capsule, tinatanggal sa capsule and then binubudbud po sa sugat. So, nangyari ba sa'yo, Dayan? Ginawa sa'yo?
Oo. Pagdating sa clinic, namumuti yung, yung sugat.
Oo nga, oo. So, ang nangyari is, ang sinasabi ko po, yung capsule is for ingestion. Wala akong nakalagay na pwedeng tanggalin from the capsule and the wound will absorb the medicine from the capsule. So, hindi po siya indicated for that. For topical ointment, pwede po. Pero yung mga capsule na yun, gawag po, ini-ingest po yun. Ang nangyayari po pag ginagawa yun is, lalong magiging madumi yung sugat and then magkakaroon pa ng mas severe na infection. So, try not to do it po. Aqua oxinada, hindi rin po kailangan. Sometimes the wound can be small pero laging nililinis ng agua oxinada, nagkakaroon ng burning sensation and then actual burn doon sa site. So yung maliit na sugat is lalong lumaki. As mentioned kanina, soap and water. Pwede na pong panglinis yun, pwede siyang i-cover. Yung sugat na pinahihinga, pwede pong, sabi kasi Dayan, bawal daw i-cover para makahinga.
Yes.
Yung preventing further infection, yung dumi, pwede po siyang i-cover. Pero laging yung nga pinanggit natin kanina, check the wound, to replace the bandage if it's needed. Pag meron na pong langib, pwede na siyang hindi lagyan. So that's the only time na pwede niya na hindi lagyan. So hindi makakahinga yung sugat. Hindi po totoo na hindi makakahinga yung sugat pag nilagyan ng cover. Keep it clean and then keep it covered para ma-prevent siya maging madumi. Pero pag may langib na po, hindi na po kailangan ng bandage. There's a question about fish, yung tinik. So, pag mahilig sa mga tinik, it's similar to discussion kanina ng foreign body ingestion or obstruction. So, yung first aid natin is, yung kapag may signs talaga tayong complete block, then you can do the maneuvers. Pero kapag yung hindi signs of complete obstruction, we just calm the patient and then let the patient rest. Alam ko yung susunod na tanong dito. Ano yung pwedeng ibigay para matanggal yung obstruction? Dayan, ano yung mga, alam mo, saging, yan. Buong saging, hiwain, tapos Ang gandang concept po na yung saging, kapag may tinik, pag nilunok niya ng buo, didikit po yung tinik dun sa saging and then matatanggal yung bara. First natin po is, if the obstruction is sa airway, so hindi po papasok rin yung yung saging dun sa airway. So hindi matatanggal yung airway obstruction. So for airway obstruction, it's the maneuvers, yung pag-backslap o kaya yung Hamlet maneuver. Pero rarely na mag-obstruct yung tinik kasi medyo difficult yun sa airway side. Ingested na tinik po na nagkakos ng irritation dun sa esophageal area, yung pagkain rin ng saging, paglunok, hindi rin niya makukuha yung obstruction. So usually, by movement, pwede ho siyang ma-pass out. In severe cases na talagang dumikit siya doon sa lining or doon sa pinaka-esophageal area, Ito, unfortunately, we have to see consult kasi we have instances na talagang hindi matanggal yung sa gastrointestinal tract, and then we have to do some intervention para matanggal yung foreign o yung obstruction sa gastrointestinal.
Sometimes
Pero wag
kasi
niyo
wag
mhm.
wag kasi 'di ba minsan Dok parang yung physiologic response natin if there is an parang obstruction is parang nati-trigger yung coughing reflex natin. So parang naika-cough out most of the time ng patient yung parang foreign body.
Yes.
So
So
siguro
may
kapag
response talaga siya. Yeah, puwedeng ano, sarili lang niya matanggal mo.
matanggal. So siguro pero pag siguro yung patient meron ng parang chest pain tapos or
Hmm.
drooling, hindi maka-swallow or maka-drink ng maayos, tulad nung sabi ni Doc, kailangan dadalhin mo na sa emergency room kasi sisilipin na yon, tapos titingnan kung nandun ba talaga yung fishbone, tapos tatanggalin kung nandun. Mm.
Yep. So pag severity is medyo mataas, puwede natin dalhin sa doktor. But yun nga, yung first aid, can do some of the first aid maneuvers lalo na kapag airway obstruction in transit papunta sa ospital, puwede niyang gawin.
Okay.
Right.
So, meron pa ba tayong question?
May mga tanong pa ba? Gandang ano, salamat po sa lahat ng mga tanong.
Mga
Sana
tanong.
na-cover namin. Oo,
Mm.
kasi naalala po namin yung mga ginagawa sa'min nung bata kami. Kaya medyo yung mga pamahiin o nakagawian nadi-discuss namin. Kasi gusto natin malaman kung ano ho yung puwede at advisable versus sa hindi naman po kailangan. Sana na-cover po namin yun dito. Kapag may mga tanong po kayo, you can still send your questions, or kapag hindi naman po dun sa ano namin,
Yun na
sa
lang.
pwede. Hmm.
We'll try to get back to you. So, siguro that ends our discussion this morning and our open forum. So, before we leave, we would like to leave some parang words of wisdom regarding for our topic today. So, Doc Jojo, mauna ka na.
Sure. Sa akin, prevention is key. If you know kung ano yung puwedeng, knowing kung ano yung mga puwedeng mag-cause ng accidents, you try to prevent it. But in cases na hindi talaga ma-avoid, you now know what are the things that you can and should not do. So I think yun, combination prevention and then first response, proper response.
And
Thank
then
you.
we also discuss yung mga severe cases. So, di ba, first aid, tapos what if parang severe na yung cases? At least now we know when to seek help, and it's very important na wag natin sarilinin, no? Let's seek help, no? So that's it for our words of wisdom and discussion for this morning. So until our next, so
See
coffee,
you on our next coffee
coffee and
and
conversation.
conversation.
Okay.
Morning.
Good morning. So thank you again, Doc Jojo, my partner for this webinar. I enjoyed our coffee and conversation this morning. For all our participants, thank you for joining us. For your certificate, you may scan the QR code or click on the link in the chat box. I will return to this slide in a while. For inquiries about us and other pediatricians and other specialists of the medical city, please contact the Institute of Pediatrics with this number. And just a reminder for all parents, aside from COVID-19, there are many vaccine-preventable diseases. Especially during this rainy season, please continue to observe minimum health standards and visit your pediatrician to get your children's vaccines updated. I would like to invite you to our upcoming webinar entitled Tempering Tantrums, Dealing with Child's Tantrums and Meltdowns. This will be on September 23, 2023. So let's learn how to deal with these common issues among toddlers and preschoolers from our developmental pediatrician, Dr. K. Napalinga. Register for free by scanning the QR code in your screen. Again, thank you for spending your morning with us today for IPLA's Coffee and Conversation. I leave you with the link to the certificate. The link will be open only until 5 p.m. today. See you in our next webinar. Again, this is Dr. Diane Pabellon for Coffee and Conversation of the Medical City Institute of Pediatrics, your partner in pediatric health. Good morning, everyone.